It's 7:29, and Board of Health meeting is called to order. So a motion to approve the minutes from the last meeting, unless there are any additions or corrections that anybody wants to make.
So moved.
All in favor?
Aye.
Any opposed? Minutes are passed. Good. Dan?
So you skipped over the item number 2 on the agenda, which is we have to, in the December meeting, we do nominations of officers for the next year, and we approve the calendar of meetings, which Andrea sent to you. And so you would basically take nominations. If you're willing to continue, you can express that, or if if people are interested in staying in their current roles, they can.
Anybody else interested in being the chairman of this?
You're doing such a fabulous job.
Anybody else? Anybody?
Always such a fight like this.
Right.
Yes, I will.
I'll put it out there. I'm willing to take whatever role is not filled. Doesn't matter to me. I'm happy to help. So.
Great. So
you'd put forward a slate if you're willing to continue as chair, right?
I am willing.
Okay, and I believe our vice chair, Ava, you're the vice chair currently?
Yes.
And is it, who's the secretary currently?
I believe it's Mary Frances. Yes, Mary Frances is the secretary.
Okay. Yeah, and Mary Frances is on the line?
Yes.
Yes, I'm on the line.
Would you be willing to continue as secretary?
Yes.
Okay, well then, it's up to the board to put forward a slate and vote on it.
Okay. Can we do that now?
Yep, you would do that now.
All right.
Yep.
So
I would make a motion that the people that were presented should be our new board. Is that the right way to do it?
Continue to serve as the chair, vice chair, and secretary.
As presented.
Okay.
You need to clean that up.
Somebody needs to second it.
all
right.
So all in favor? Any opposed?
All right. Unanimously, and then we have a calendar there, and somebody would make a motion to approve the calendar.
So I'll make a motion to approve the calendar.
A second.
Okay.
All in favor of the calendar? Any opposed?
Okay.
No opposed.
All right, so we're good.
Calendar is all set.
Good.
Great. Sorry, I messed that up either.
That's okay.
Was there anything else before we go?
That's it. That takes care of the December business,
Yay.
So I'll go into my report. So just in terms of clinical update, we've had 3 clinics in the last month, 2 Moderna booster clinics with just under 200 people, and then we did a children's flu clinic which had about 36 people, and then we've been having just as people call and make appointments for flu shots, we take them in the office, and they've done about 75 flu shots. So the demand has kind of waned for flu shots. The COVID shots there's still a draw for that when we have the clinic days. So we'll continue with that.
Did you max out on those for the booster clinics? Like, was 200 the amount you had?
No, we could have done more. Yeah. So, I mean, it's not, there's just not the demand as it used to be because, everybody knows you can just go any day, anytime to CVS or Walgreens and get them. And so.
They don't go to waste, do they? I mean, can the shots be stored for a...
I forgot to record.
Okay. We'll just. All right.
Okay. All right. I'll just leave. It'll be fine.
Is it not recording?
I think it is. it was.
Okay,
I'm just
okay.
a little
So,
off. I'm getting
little
over a
confusion with
cold,
the
so
recording. All right.
sorry about the recording.
All right. So we'll continue with that, with the clinics, and again, we just order what we need, and with, at least with the flu clinics, we can send back for a credit what we don't use when it expires, so we get a credit towards our next year's order on that. And so we'll continue doing that. I thought I would share a presentation that we got last week, just talking about respiratory viral disease trends going on in the state right now. And so this is something the state gave us. So this first slide is RSV showing you sort of what's happening now. This is sort of the, I want to make sure I'm reading it right. So this is the 21, sort of summer bump in 21. Coming down, and then, Santina, your eyes are better than mine.
Yep.
What are these dates down here?
So that is July 22.
So July, it started going up, and then right now, we saw this big peak, and what the state is saying was we think we've seen some plateauing right now. When it goes down like this, there's always late data coming in, but the state is, for the last week, started saying, we think we're seeing some plateauing of RSV, which is good because we'll show you in the other ones. But here's RSV. This is year over year. So this is to understand this. This is October through September chart, year over year, and so you're seeing 18 and 19 with the X's there, red X's, and then the 19-20 with the purple dots here, 21-22 in the solid green, and then right here, just the start of this season. You can see it here, how we compare to previous years. So we kind of peaked out over even the highest year prior to COVID. And so that's why there was a lot of concern about, the tridemic, if you will, of if they all hit at the same time, that's going to be bad, as you all well know. And so it seems to be coming down.
Do they have any evidence why that is it because of everybody wearing the mask for 2 years?
That's initially what they were saying, is that during in this phase here, that everybody was wearing a mask, everybody was social distancing, nobody was doing sports, nobody was interacting in the same way, and people were more cautious. And then
No, but I mean for how much of a spike it is. Is it just that it was all like kind of concentrated and now everybody's getting it that would have been more spread out before?
Yeah, I'm not sure. I mean, there's typically a summer bump in RSV. That's fairly typical. You'll see in previous years here, you see it start to go up and then it kind of creeps down as school starts. You'll see in the other, it was follow the same kind of trend. There was a COVID September bump, so it's kind of following the same thing. But I haven't heard any recent changes on why they think it is. Lynn Sosa, the state epidemiologist, said it could just be that we've just upset the cycle of RSV. That it was suppressed for a couple years, and now as new populations, older kids that were never exposed are getting exposed, and younger kids who normally get exposed are now getting exposed, and it's just hasn't had a chance to stabilize back out again.
Well, I'll tell you, I've been admitting kids much older than we would normally ever admit for RSV.
Really?
Yeah, like 4 or 5 year olds that are hypoxic, which we would never see. Like those, they should just have colds.
Yeah.
Usually it's that much lower age bracket, that less than 6 months, that are your normal hospitalizations. But this year it's been that older cohort for sure.
In the past, were you testing for it or?
Well, so I think there's some testing bias, but at the same time,
Right.
the hospitalization piece, I think, sort of tells a different story than just the testing bias of the number of positives that we
Right.
see.
Yeah.
We're definitely hospitalizing more. It's been very hard when we do have to hospitalize them because we haven't actually had room to do that. TCMC and Yale have been maxed out, boarding all over the place. We've been shipping kids anywhere and everywhere. We've maxed out at our hospital, shipping to other ones that we would never normally transfer to, just holding in the ERs a lot. And it's been a much more difficult year.
ICU intubations,
Yeah.
Yeah. This is hospitalization data.
Yeah, okay, right.
And then influenza, what we're seeing now, you'll see Connecticut here is second to the highest level of activity already, while, a lot of the country is kind of, there's a certain amount of the country that's a little bit higher than us, but a lot of it is in some of the lower categories.
What's the gauge on that? Like, how do you determine high level versus minimal? Like, compared to what, I guess? Is that just like looking at all 50 states and, compared to each other, or what's the index?
Yeah, I guess I'm not sure exactly if what the metric is they're measuring,
Like you said, testing device.
I'd have to look at that. It doesn't say it right here what it is. But, to see what we're experiencing in Connecticut right now, here's back in January 2020, this is influenza activity, a pretty standard epi curve, and then July 20, January 20, July 21, all the way up until January 22, we see this tiny little bump, and then a little bit of a double spike bump there, sort of the end of last school year, and then, and this is what the state's talking about, like, it really just exploded this year, and they're seeing it, seeing really high peaks going on with lots of activity, and just for a year-over-year comparison, this is ED visits for influenza-like illness, and so you'll see, again, September through July, August there, of year-over-year, and with the black being where we are currently going up. So we're a little earlier this year than previous years, but we haven't peaked on what we've seen in, even in 1920, a little bit above 21, 22. And you'll see the hospitalizations, total hospitalizations for influenza-like illness, only one fatality so far, and then a little bit of the, breakdown of the types of what we're seeing, mostly unspecified. And again, just hospitalized influenza. And so you're seeing a little variety of, some H3N2, a little bit of B. This is, over time, and this is the age range, very typical age range that we're seeing. And then COVID-19, even though this is a week-old data, this is still the how it looks on the CDC website. For Connecticut, we're in the medium category. And then just to give you a picture of what we're seeing, and we'll see some of these on the other ones, but compared to year over year, the blue line is this year. And so in terms of cases, we're seeing low levels, but, again, we also have this whole testing bias going on of people are just not going for PCR tests anymore. They're going doing home tests. Hospital census is staying relatively level in Connecticut as compared to previous years at this time. It was really starting to climb and go up. New admissions, same thing. In previous years, you were seeing some early activity. Typically, we would start seeing things go up after it was usually Halloween would start it, and then Thanksgiving would give it a boost, and then Christmas break would launch it into the stratosphere. So we're not seeing that same trend going on this year, and we're even seeing, while the activity level is still high, we're not seeing it go up, and deaths are even trending downwards. And so here's just the cases and 7-day average, 7-day average being the red line there, of what we're seeing recently. And so it really is relatively level. And then the year over year, this is just a larger slide of what was on the other slide there before. And then this one I found interesting is you can see the age breakdown for COVID cases. So it's really the folks that are 75, 65 and older. It's following a pretty close to the what you would expect is that those 55 and over, those are the most impacted, and those 24 and under are the least impacted, the fewest number of cases. And then just this is what's going on in the schools, and with the red line being just the number of schools reporting, about 350 or so schools reporting, with yellow staff, blue being students. And so you saw that September bump, and then thankfully it's just continued to trend downward. For the most part, we're starting to see some increasing, but in general, it's, kind of trending downward in terms of cases. And I thought I would go over to here to see what's going on in the country, and you'll see in the country, in the U.S. as a whole, cases are going up, total deaths are going up, hospital admissions are trending downward, and similar to the flu map, here's where the hot spots are. With the darker colors are seeing more cases. So that's where we are with COVID. And so thought I would share a little bit about last month. We talked about the water pollution control facility, I think, and we talked about that. And there was a component that broke. Part of the processing facility broke. One of two digesters broke, and the fixes that they put in place, what the result of that structural failure ended up causing the byproduct, if you will, the solid biosolids to be more odorous. And also they had some issues with the secondary digester that for a time they had to take off the roof to prevent pressure buildup, which is what caused the other digester to fail. And so we've been involved in terms of there's a number of odor complaints, so we respond to odor complaints and trying to look into that. So we did talk to the state. The state really said, that while it's very odorous, it's generally hundreds of times below the levels which would cause any kind of health effects. It's just a very, the hydrogen sulfide that is a byproduct, it's just a very odorous substance. And so, but the town agreed to conduct testing just to confirm what we've been advised. And so we did hired a company, HRP, and they, on December 2nd, went out and did some air testing. And so we're waiting on a report from them with the summary of that. But they did, both personal samples for the staff that works there, while they were wearing monitors to do sort of OSHA type of testing to ensure that the workplace is safe. They already have monitors like those at the facility that they've put around and prior to that, and they weren't getting any kind of hits, they use it for confined space entry when they go down into the wells and things like that to make sure that they're safe to be in there and they're not getting any hits on those meters that they've set up. So this company came in and they're doing both personal samples, area samples around the perimeter of the sewage treatment plant, hydrogen sulfide, oxygen combustibles, VOCs, SVOCs, and particulate matter. So they're doing a whole range of different types of tests, and so hopefully we'll get the reports back, and we'll wait and see what those say. But there was general there's nothing that alarming, nothing that needed us to take immediate action on the spot, and so but we'll wait and see what the report says. That should come out hopefully by the end of this week. They did early in October had this additive which caused some problems, a very acidic type of product. They switched that out, let that cycle through, and now they've introduced a new additive. These are odor control additives, and that one, at least for the week or so that it's been in place, it seems to be helping. It's a very qualitative kind of assessment. It's, the folks down there just kind of smelling, and they said, well, all of our noses down here are kind of used to this stuff, but they said in general they feel like it's think that the product seems to be lessening the smell. We haven't received as many complaints in the past, but that could simply be, they all made their complaints. They know what's going on. They know we're testing it. They've had several, WPCF public meetings where they've said, this is what we're doing and this is how long it's going to take. So hopefully they'll open the bids for the repair work this month for the first primary digester, and the work will take probably a month to start with gathering components, and then somewhere in the spring they hope to have it all fixed and back to normal operations. So we also had a meeting with UI this past month, and UI has explained that Due to did I share this discuss this at all last meeting now? Due to the, global political situation, that there is a bit of a shortage of liquid natural gas because, well, it's a, geopolitical, the demand, because what's happening in Europe, there's less Russian liquid natural gas, and I'm not doing a great job of this, less liquid natural gas in Europe right now, so they're having to buy it from other sources, and so the prices are rising. So all the liquid natural gas from Canada that would normally come down here is now sitting in ships off of the coast of Europe and being sold at higher prices to European countries. And so UI is a little concerned about their supply of liquid natural gas here, being that that's the predominant fuel that they use to generate electricity. And so what they are preparing the state for, and Eversource and UI are both in the same boat, but UI in our area, is saying that if there is a particular extended cold snap, that they may have to implement rolling blackouts. And so it would essentially be, depending on the expectations, they do some predictions in terms of how bad is the weather going to be and how long is it going to extend that cold weather, and depending on that, they will either do, we need a 10% reduction in power or a 25% reduction or even greater. And so in general, they said if it's a 10% reduction, that basically they have their circuits, set up that basically 10% of the circuits will go off, on a rolling basis throughout the towns in their area. So 10% of the circuits in Fairfield will go off, 10% in Easton, 10% in,
All at the same time?
So they would, not the whole town, but that one area. So there would be 10% of each town would go off. Those circuits would go off. And then with the 10% reduction, it would be for 4 hours, 4 hours every 24 hours. Mm-hmm. So, and then the second 10% would go off for 4 hours, and then that other one would come back on, that one that was out, and they would cycle through each town that way, to achieve a 10% reduction.
Do they usually demand? That could be residential, or is it more like commercial buildings?
So it's a little bit complicated, but it's going to be everything. That everything in that area, and there's some exceptions to that in the sense in that if you have low pressure gas that in your area and I'm not going to explain this great, but if they put off the power in those areas with low pressure gas, then all the pilot lights go out, and before they can re-energize that area, they have to send a team in and go and make sure all the pilot lights are lit in those homes. So it extends the process. So if in the scenario where it was greater than 25% reduction, they would consider shutting off those areas in addition, but those areas then would take anywhere from 8 to 10 hours to restore power, because they'd have to have a team go, and they have a system of where they would go to a particular neighborhood, on a particular gas line, and say, okay, these 300 homes, let's turn on the gas, let's go door to door, make sure we can get to everybody in a timely manner. So the neighborhoods with low pressure gas would be the last ones to be turned off. So this for us brings a scenario where, okay, so there's a potential that restaurants and nursing homes and other facilities are going to be without power for 4 hours at a time. So it's not a crisis mode. It's not it's something that most of the nursing homes have backup power that can, but it's an issue of, get your generator tested, make sure you have plenty of fuel, all those types of things that, every time there's some kind of power outage, one nursing home or another somewhere says, the generator failed because it hasn't run in 6 months, 8 months, a year,
Mm-hmm.
And so It's, so they're doing communication, UI is doing communication to those facilities. And so I've asked Rob to put together a policy that we'll probably bring next month on, here's what the health department and the Board of Health feel like food establishments should do during that time, And so we'll come back with a policy on that. But
do they try to do it in the middle of the night, or it could be all just kind of rotating
it's going to
throughout
be
the
4
day?
hours, and it's 4 hours throughout the day. If it's above 10%, then it goes 4 hours off, 8 hours on, 4 hours off. If it's the 10% reduction, it's 4 hours out of every 24.
So the main variable is that there's a real cold spell, because a lot of not everybody has, there's probably a good percentage have electric heat in the homes, right? And not every.
Most people don't have electric heat.
Right.
Yeah, no.
Most people have oil or gas.
Most people have
right?
oil or gas heat, and so for 4 hours, a home, it's not going to drastically change. You might have to put on a sweater, or an extra blanket, but it's not going to be that bad. And the peak times for energy demand are during the day, and so these blackouts, there will be some overnight, but like what they're really trying to reduce is electricity demand at peak times, and so.
Right.
Are they indicating based on supply how likely the scenario is to happen?
Well, yeah, I guess they said it's difficult to predict exactly how, but basically, it's the type of thing that if the forecast calls for an extended cold snap, that there will be a call somewhere early in that cold snap to say, all right, well, we can only provide X amount of power based upon our fuel reserves. And so they have to balance that, and obviously they don't want to do it, but
so they do expect it to probably occur at some point if we have a pretty cold winter.
If there's an extended cold snap,
really pretty likely scenario.
I'm sorry, it came to mind, like with schools, or like, when it's the heat too hot in the summer, you have heating, cooling stations. Would they need heat stations? Like, I didn't know if you're for a 4 hour block, it shouldn't dramatically affect the temperature in the buildings and things like that. And some of the buildings do have generator backups, and so they can maintain some of those things. But this is going to be a statewide situation, New England-wide situation, that they'll be monitoring. But basically, they're meeting with all the towns to say, get ready, be ready, don't be surprised by this. And there's public communications going out as well.
Yeah, how is that communicated to the town if that decision is made, or just?
Oh, it'll be all over the media. Yeah, it'll be all over the media. UI is already sort of, they're meeting with the towns to let the town leaderships know, like, hey, this is what's happening, and they've already put out some public statements. It hasn't quite caught in the news yet.
Going to.
But that first cold snap, they're going to be saying, guess what? And they said, like, even without the issue with liquid natural gas, currently, that, a few years back, there was an extended cold snap that was, I think they said it was like 8 to 10 days. And they said towards the end of that, we were starting to think about it. They said, this is not for us, meaning UI, this is a thing that we look at all the time, but we never really thought it would come to play, except now that the fuel isn't quite as readily as available as it was prior to this, because there's just less supply, because nobody's buying liquid natural gas from Russia anymore in Europe, and so there's just less supply here. So anyway, just mentioning that to just make you aware of it, and hopefully make the town a little bit more aware of it, but that this is a potential or a possibility. To update on our radon program, we had distributed 100 free radon kits that the state gave us. So far, we've gotten 23 of those have come back with results already, and 5 of the 23 had elevations, and so our staff has reached out to them to discuss with them, radon remediation systems and available programs for that, and talk about, you typically do the screening test and you follow up with another test to confirm that. And then you would, you can pick from a list of contractors, which they provided them to say if you're interested in doing this. So which I thought was pretty good, of the ones we've got back, we've already got 5 where we're helping people figure out that they've got radon in their home. We did have the Rob Guerrero, who's here last month, and Santina did attend National Public Health Workers' Day celebration in Hartford.
Rocky Hill, yeah.
Rocky Hill at State Lab, right?
Mm-hmm.
And we did get a little recognition from the governor. I'll send it around, an official statement recognizing the Fairfield Health Department, thanking us for our work. So it was very nice. We'll get that framed. I unfortunately had a Board of Condemnation meeting that day, so I couldn't make it, but Rob and Santina represented us well.
That's very nice.
And I thought I would share recently, I think I mentioned it a couple months back, but the state did receive the Public Health Workforce Development Grant. So at the federal level, there's $3.2 billion approved for public health workforce development, infrastructure improvements, IT improvements. And so when it comes down to it, the state got $32 million for this, but it's over 5 years. And the state has committed to $12 million of that over the 5 years will go to local public health. And so when you break it down, I mean, while any additional funding is great, when you break it down over 5 years, it's a little bit less, about 10% less than what our preparedness funding is that we get through the feds as well, which is, not enough to support one full-time equivalent. So it'll likely lead to, so there's going to be some discussions going on about, well, will it really change public health to have an additional part-time person in each health department? The big cities will get enough funding to staff, a full-time equivalent or more. But most towns, under that probably won't. And so we'll have to look at what, as the Connecticut Association of Directors of Health, we'll have to look at and say, what's the best use of this funds? Is it the best use to all take our little slice and not really change, move the needle in terms of changing the workforce, because a part-time person here is not really going to change much for us. And once the funding goes away in 5 years, well, then that person goes away. And so we're looking at, I know the state has already entered an agreement with Yale to create a public health training institute where they will, similar to, not exactly similar, but of the same way that when you hire a new police officer or a new fireman, they go off for, 4 to 6 months and get trained on, a specific skill set related to their profession. And so Yale is looking to do a similar type of thing. Currently, we have only once a year, we have for environmental health, a program that trains folks in environmental health, sort of January through May up at Southern Connecticut State University. So, but it's only offered once a year. And, sometimes it's depending on when you hired somebody, you can't get into it, or you have to wait almost a full year to get into the program. And so they're looking to improve that to make it, a better delivery methodology. So when people start, they can kind of get in and, hopefully have multiple cohorts per year to change that. But, that Southern program only addresses environmental health. So for public health nurses, there's nothing. For health education, there's nothing. I mean, there's continuing education, but there's no official program for administration. There's nothing really, and so this is designed to have some kind of structure to training, which I think is probably a better use of the workforce development money. And so we'll have to, talk about the best ways to use what that $12 million is coming to locals. What is the best way, to get more people into the profession and to offer them a meaningful, to get them in quicker, better trained, So that's what we'll be working on with others. So that's my report. I think that was everything I wanted to say.
Okay.
Sure.
I have one question. In the terms of the town of Fairfield, how is the flu affecting the seniors? Do we have a high ratio of seniors getting sick, or not necessarily? I couldn't really see that.
Yeah, if we go back here, this is, I think we had one chart on, this is influenza, this is hospitalizations, so, and you'll see here the age range that are most impacted. It really is, once you start at 60 to 69, 70, and 80, that's the highest group impacted, those groups. And so it's following a typical pattern of a typical flu season, is that it impacts those who are senior citizens a little bit more than other individual age groups.
Now, I was just wondering if the relationship between, say, Fairfield and another community, if we were higher or lower in terms of people getting sick?
We don't have any data specific to that. The state has really changed, we don't get as many flu reports now, and so we don't have readily access data down to that sort of silos. A couple years ago, we used to get our finger on the pulse by all the in-office doctor's tests were reported to the local health department. So we had good data to say, even with just a office screening test, to say, hey, we can see the epi curve, if you will, of what's going on in town, but we don't get that data anymore
I can tell
in
you
the same way.
A ton of
Yeah.
You too, probably.
Yeah.
Flu? Oh, and the urgent cares,
Yeah, the flu activity is through the roof already. So that's what the state is saying, is like, we are at a peak now. That's why I was saying it's good that RSV is kind of coming down, because flu is going up, and we're fearful that COVID, while it's very active right now, it's what we're seeing here, is that it's kind of level here, but if it was to go up now at the same time as flu, and while RSV is still relatively high, as you said, in the hospital, the fear is like in the hospitals, will you be able to get the level of care you need? If every bed is filled with RSV and influenza and COVID, it presents a challenging situation for the medical profession.
Is there good data in terms of the vaccination in the town?
Yeah, we can still get that, and our vaccination rates are pretty high. I was
for influenza.
Yeah. For influenza. I don't think I have any data on influenza vaccination rates.
I don't think a lot of people, they're so focused on COVID still.
Yeah, no, it's a real...
Every time I ask, they're like, oh, I forgot it.
Yeah, no, it's been a big problem, actually.
Yeah.
It's also knowing the timing of it, because...
We'd have to look at,
Because based on these numbers, I think for next year, I think we should probably push people to get it earlier. A lot of times, like we say, well, get it, by mid-November, and then you'll be okay. But things are peaking.
Yeah, they really peaked so early this year.
I have to over the summer.
Yeah. So I think maybe early September we should push for...
I also feel like this flu...
Yeah, we always try to, it's this balance of
diminishing.
We want to have the clinics
what do you think?
as early as we can,
People that are vaccinated.
but sometimes our vaccine doesn't arrive until the first week in October.
Right, no, it doesn't arrive. And then the other issue is how long, what the effectiveness in the back end.
Yeah.
Like later in the winter, there's always thought that if you got it too early, that it was like a 4-month window or so, or however long it is, and then there's always, there could be a late peak of influenza, and then the vaccines aren't effective anymore.
Yeah, and that's always the gamble with flu is even the strains that they put in it. It's all right, we're basing on the Southern Hemisphere last year, and we try to predict that, and then you never know when it's going to come.
Yeah,
we've seen it both ways. It's typically that January, early February kind of peak, typically, but COVID has thrown everything for a loop, and so I think everything's behaving a little differently right now.
Mhm.
I
So
kind of have
we'll
a
see.
feeling it's gonna, because right now when we test, we see influenza A.
Mhm.
I mean, in the past, I've seen like a second wave of influenza B kind of later in the winter. I kind of feel like that's gonna happen again.
Yeah, yeah. Well, it's out there. I mean, they were, talking
I
about
haven't
it.
seen any bees, yeah.
So the flu's got another
Wave coming probably.
Yeah, so, here you'll see a little bit of B,
Mhm.
showing up. The orange is what was showing up already this season.
Oh, well.
So we're seeing a little bit of that. It's not typically the predominant strain anyway, but,
Are they tracking co-infections at all? People that are positive for, flu and RSV, excuse me, or flu and COVID, or, rhinovirus and flu or whatever. Except we're actually seeing a lot of that
yeah.
in the hospital. I'm wondering if that's being tracked at all, and then how that relates to severity of illness and hospitalizations.
Yeah. I haven't seen any data on that. Have you? No, I haven't seen anything specific to that. Next year, so what they're changing now is, as you may be aware, so they passed a law that said the Connecticut Immunization Registry now you have to upload all vaccinations, regardless of where you are, into that system. So every flu shot, so next year we'll probably be able to see
Right.
flu shots
Great.
at the local
That's
level.
Very helpful.
It just depends on the reporting out capability of CT-Wiz, which is the immunization registry. It has some, I'm not an expert in it at this point, but I haven't seen, if it was available, I'm sure the state would have shown us. That's what they use to track COVID vaccinations is, that was the big requirement. If you're going to do vaccinations in the state, you had to be able to, within 24 hours, report it to CT-Wiz. And so,
I know the law was passed, I think this past year, that's supposed to provide all listed licensed healthcare providers access to it as well for our patients. And I've never seen any instruction on how we can actually access that to look up our patients.
okay, yeah, you can.
So
You can. I mean,
yeah.
it's.
But that education out there, so I'm not sure how readily,
Yeah.
to your point, how readily accessible that
Yeah.
information is to everyone yet.
Yeah, I mean, you have to go through a few hoops, but like we have all the school nurses now have access to, so if somebody comes into the school nurse and says, I know my kids got vaccinated, when they were younger, and as long as they got vaccinated in Connecticut, they can look it up and say, okay, yes, I see you're vaccinated here, and they can, make notes on the records to say, yes, we can confirm that. So hopefully over the next few years, that'll dramatically improve. The pediatrician's office have typically been very good about getting things into CT-Wiz, but the CVS's and the health departments, like we don't put our flu vaccinations into CT-Wiz, but we're going to be required now. So every clinic in the future going forward, we'll have, like with COVID, every nurse will have a laptop, at their station and be entering it into CT-Wiz as they go. So,
Why did your access to data change? You're saying you don't receive it from the local offices anymore. What happened?
So the state stopped requiring in-office reporting of flu tests. So the little quick rapid tests for flu, they no longer have to report those to the state or the local health department anymore. And so that for us was a great indicator. I could tell every day,
We would get like 10 facts.
you open the envelope and here's like, you get a couple envelopes packed thick and it's like, all right, Willow's Pediatric, here's 20 cases. And you say, okay, flu's here. Like we would see very clearly, and then we could generate epi curves, which we would do to say, all right, here's what's happening right now. And, now we're starting to see it. But so it was a very, easy way to do it. But now they've eliminated that reporting requirement. Still have any laboratory tests. And they've made it easier for a lot of the practices in the sense that it's automated now. If you send someone to a lab, any lab in the state, that result automatically gets reported to us and to the state. So because we have access to the program called CT-EDS, which is the disease surveillance system that we have. So
But how about the electronic medical records, like where we have, can't they anonymously get just numbers of how many positive flus and COVIDs are reported on site instead of at a lab? We don't do a lot of stuff at the lab. We do them all at.
Yeah. So again,
would be great if
there's no requirement anymore to do that, to report any of those.
Yeah.
So it would, so the state isn't even collecting that data anymore, but they all used to be reported And so,
Oh, yeah.
so it was kept a finger on the pulse of things a little bit better, versus just only lab tests. But the state's position is that, well, it's not hard to figure out when flu is here. All the doctors know, and just even with just the lab tests, they can get a feel for what, what's happening. They know the reality, and they've always known that, even with all the in-office tests and the lab tests, there's 10 to 15 times more cases actually out in the community than what we're seeing in doctor's office, that people just say, I'll just hunker down and weather it out. And, so the state's position was like, we can live with just the lab tests. That'll give us enough data that we know, like, when it's here, when it's coming, if things are different, if there's more B, if there's a unique variant, something like that, we'll see it in just the lab data, because the lab data reporting has improved dramatically.
Okay.
Sure.
Me. So just a quick update on some of our programs. So we finished up Matter of Balance back in November. So Matter of Balance is a fall prevention, or the risk, to reduce the risk, or to reduce the fear of falling prevention program. So it's an 8-week program, once a week for 2 hours over at the Senior Center. We completely maxed out. We can only have 12 participants, and 10 people ended up finishing the program. We have enough on a wait list for another class, and so Julie, our public health nurse, was trained in the program with me, and so after, she's been crazy busy with COVID boosters and flu clinics, but we're hoping to do something in the new year, have another program. But it was a really successful program, and like I said, I was able to train Julie and Emma on the class as well, so they can offer it as well. Our Healthy Lifestyles program is a 13-week Healthy Lifestyles program that we meet once a week, every Wednesday, over at the fire training school with our registered dietitian. We have 8 people in that class, and so far our group has lost 32 pounds collectively, which I'm really proud of them for, and that will go well into January, so we still have a few more weeks on that program. The good thing is that we're able to offer it in person and via Zoom, so we actually have one person who's a snowbird and went down to Florida, but she's still able to participate, which is really nice. Our diabetes and chronic disease support group is back in full swing. Just to kind of give you an idea of attendance, in September we had 9 people attend, October we had 12 people attend, November we had 7 people attend, so this meets for an hour once a month over at the Senior Center. We actually have our class tomorrow, and it's on Parkinson's, and I already know that there's going to be a lot of people because we've received a few phone calls, and that is like no reservation, you just walk on in, so that's back to kind of pre-COVID numbers, which I'm really happy about.
When is that one?
It's the second Tuesday of the month, from September to June, from 1 to 2. At the Senior Center.
About Parkinson's the whole time?
No, just this month. Yeah, so each month is like a different topic. So we did a topic on sweeteners and memory and fall, and so we try to pick the different topics that our group is interested in and try to get speakers or presentations. So, and then Julie and I have been talking about Know Your Numbers. As part of the Greater Bridgeport area, we really try to kick off Know Your Numbers in February for Heart Health Month. And some of the ideas we had is maybe every Tuesday from 9 to 2, people can walk in and we can do their Know Your Numbers in addition to going out into the community and doing it for the employees. So those are some ideas that we've been playing around with. Nothing definite yet, but we've definitely been talking about it. So that's all the programming going on. As far as our grants, our preventative health block grant finished up. We received about $15,000, and we helped to install some sidewalks on the west side street of South Pine Creek. And so we installed 600 feet of sidewalk, but it actually connected almost 1.5 miles of roadway. And so really excited about that. I'm proud of that project. So that wrapped up in September.
The other grant we work on is our ELC funding, so that's all of our COVID money. We have 2 case investigators on that. So they're still making the COVID calls. We are still making 2 attempts. We're averaging about 12 to 15 cases a day. People are still receptive to those phone calls. I think they're helpful because people still have questions about then, like, boosters and, when can they actually break isolation. I think there's still some confusion about that. So we're still making those calls. They also run our monkeypox report every day, our Ebola reports. They do check the flu stuff, just so they're doing all that surveillance for us. They're also working on an infectious disease quality improvement project. So what are the infectious diseases that are reported to the local health departments per the state? What are those diseases? Who's in charge of doing the contact tracing? What are the questions we need to ask? Or how is it transmitted? What is the incubation period? All of that stuff in one document so that we can be prepared for that.
And that's, part of that is, we're looking at improving our onboarding process for new employees. We've had a handful of new employees start over the last couple of years, and we've been saying, well, we need to look back at this stuff, because, we get into the mindset of, well, we know what to do.
Mm-hmm.
All right, a salmonella comes in, all right, give it to Rob or John, or, and somebody will give them a call and say, hey, let's talk about your food history, and, and hepatitis, and get to go to Julie, or tuberculosis will go to Julie, and we divvy up things, and lead report will go to one of the lead inspectors, or one of our inspectors who has lead certification. So, but, for the new employees, they don't know that. So we're trying to say, all right, let's up our game and have a document that explains what we do here,
Mm-hmm.
For each of those.
So that's one of the projects they're working on. And Emma's working on our ELC deliverables right now as well. Another quality improvement project we worked on was redoing our website. Because as the town, we are moving to a whole new system, and so we thought this would be a good idea to kind of fix things up before we move over to that system. So one thing that was driving me absolutely insane was our files and documents page. And poor Andrea was calling me saying, do you know someone's deleting and moving all these documents? And it was all me. We had 25 folders. So we would always tell people, go to the files and documents. That's where our fee schedule is and our different reports. And, you want to be a vendor, here's the application. And it was just kind of all over the place. At least I thought so. It was just kind of all over the place. We had 25 different folders and then subfolders. So we narrow that down to 11 folders and then different subcategories. So for example, we have now just the environmental health, and there's all of the fee schedules and this application and that application and cosmetology and health education, and there are these, and community health, here are our reports. So I think it's a little bit more organized. It's also alphabetical order, which made me very happy. So that was one of our projects that we worked on. We are also working on our annual report to a DPH that's due in February. We've been doing a lot of our own content creation on social media. Right now, our message has been the preventative steps to avoid COVID, flu, and RSV. That's what we've really been pushing out. And as a matter of fact, while we were talking, one of our messages should say, even though you've already gotten the flu, still get the flu shot to prevent flu B. So we've been doing a lot of that. We helped create a letter to all of the school nurses, and it also went out to the superintendents on the preventative steps, because we've seen such an increase in the schools. So the nurses were able to send it out to their communities, and then the superintendent did send it out last week as well. And that's it.
Very good. That's great.
Yeah.
Yeah.
Excellent. So the diabetes education, is it divided up in type 1 and type 2? It's all common?
Yeah, it's all chronic disease and all diabetes. Yeah. So that's why we try to do a different topic every month.
I see. So you just talk about nutrition and
Mhm.
exercise, that kind of just general information for everybody.
Yeah, and it really drives from like whatever the group is interested in. So, you know, they've told us the topics that they want for the year, and we try to base it on that. And then people are welcome throughout.
Do you find that our seniors have good access to primary care? Or are they lacking, you know, either through just not being plugged in at all, or, you know, not having transportation, et cetera? You know, do you find that they get the care they need with the people that are coming to the senior center?
Yeah, I mean, just based on what they've told us, it seems like transportation tends to be the barrier, because the senior center van will only go certain times. And I've just experienced that really with our booster clinics. We had a clinic on a Saturday and someone wanted to get a booster. They ended up getting their booster, but, you know, the van doesn't go on the weekends and the time restraints and stuff like that. So that's just what I've heard tends to be the bigger issue.
It's true.
Mhm.
Unfortunately, but
Yeah.
it's tough.
I also think it's hard, I mean, more and more it's hard for people to find primary care doctors, as some primary care doctors retire, and there aren't enough Dr. Seminos around.
And the hard part as a senior citizen is to get a primary care doctor when your doctor is retiring.
Absolutely.
I thought with my dad that, oh my goodness, I have to get new doctors, and now I'm the one finding out that I have to get new doctors.
It's a real problem.
It's really weird.
In the country, especially here.
Yep, pick a young one.
Right.
You're set for life.
Yeah.
Unless they move, and they work for 3 years and they go work, they need people move and.
Yeah.
Sure. It's hard.
It's a whole other topic. Thank you very much. Were there any communications anybody had from
Nope, I did not.
anybody? Is there any old business that we didn't, I think we got to everything? Any
No,
new
we have
business?
nothing on the agenda.
No new business?
No new business.
Any comments before we close up?
No, just thank you to the three of you for all you do and those that work with you.
Thanks.
I appreciate it.
Yeah, very much so. Thank you.
Where's Jill been? Does she not come to the?
So what we've been doing, I think I shared that we're rotating now. So Jill and Rob and Santina will come.
Oh, okay,
So
great.
essentially they do for their program. So it was typically, you know, I would present for everything else and Jill would do school nursing. So
Right.
we've changed it to I present on some stuff and then once a quarter the board would get from the different, you know, major programs at the health department. So community health is Santina,
Yeah.
Jill does nursing, Rob does environmental. So
Very good, okay.
I won't take offense.
I didn't mean to play that as a
kidding.
full. I'm so sorry.
Okay. I'm kidding.
No, I loved hearing all that stuff. I learned so much today, thanks.
Yeah, I think all the programs are really excellent. I
Thank you.
wish more people would take,
Yeah.
would get involved. I think it's so helpful.
Is it always the same group of people coming usually to the monthly meetings or?
Yeah, to the diabetes, yeah, we tend to get the same amount of people, and then you have the people who are just interested in certain topics, and they'll come to those ones. And then our Healthy Lifestyles program is a set group right now, and so we will have another program launching in February. But to lose 32 pounds, I thought that was pretty.
It's really
great.
Yeah.
Fantastic. Good.
now, Mark, isn't that your specialty? Are you specialize in?
Kidneys.
Kidneys.
I take care of
Okay.
a lot of, so I make sure our dialysis unit and the other dialysis units in town have their generators checked.
Oh,
Yeah.
It's huge. And I'll talk with the people at St. Vincent's and make sure I'm sure they have their generator. I'm sure that's already.
Kidneys, nephrology? Nephrology,
Yes.
okay.
Yeah.
All right, and was that what Dr. McDonald was? Was he a nephrologist?
Dr. McDonald.
I don't know that name.
He's the town medical advisor and school medical advisor. He was the former chief of medicine at Bridgeport Hospital for years. He's been retired for a while.
Yeah, because I've always worked at St. Vincent's ever since since
Yeah.
2008 when I came here. But
So your kidneys, what's a doctor who specializes in the liver?
hepatology.
No,
Or gastroenterology.
He might be a nephrologist as well.
Maybe.
Okay.
It's possible. For sure.
Yeah, I think he was. But,
If you get that frame, definitely get that frame.
Yeah, that's true.
yeah,
I think that's really very nice.
Yeah.
It's good. It's really good.
If you get a chance, go on our social media. I posted some pictures from that day,
Oh, great.
and I get a chuckle out of all of the health departments that were there and health districts. We took a group photo.
You got to meet Governor Lamont?
No, the commissioner. Governor couldn't make it there. But you see in the back is Rob Guerrero.
Towering over everybody.
Like he almost looks photoshopped.
At least he wasn't at the front to block everything down.
Well, he was originally. And they all started yelling at him. So
That's funny.
That's too funny.
it's up on our
Were you
social
there
media.
too?
Yes. Yeah. So it was very nice to
That's really nice.
get that recognition.
Oh, yeah, absolutely.
Not good. That's great.
Congrats.
Yes. Well, if there's nothing else,
Sure.
a motion to adjourn. Second. We are adjourned.
Okay.